This is Digital Health Today, episode 49.
You think about connecting your own brain activity to a floating brain in front of you can really teach you quite a bit. Imagine the potential to teach people and to display in a graphic way Alzheimer's or Parkinson or contusions, concussions. The potential is only limited by how creative we can be.
Welcome to Digital Health Today, the podcast focused on the leaders, innovators, and technologies transforming healthcare today and tomorrow. Find us online at digitalhealthtoday.com.
This episode is brought to you by DocSF, the digital orthopedic conference, bridging digital health and clinical orthopedics. DocSF will be held in San Francisco on Sunday, January 7th, 2018. Join world-class leaders in healthcare in this jam-packed meeting and enjoy a 30% discount. Just visit docsf.org and use discount code DHT30. That's docsf.org and use discount code DHT30. Welcome back. This is Digital Health Today, the place to be to get the insights of leaders working to make the healthcare of tomorrow available today. I'm your host, Dan Kendall, and this is episode 49. Today we're going to talk about solutions being powered by augmented and virtual reality. It wasn't that long ago that holograms and immersive environments were only found in Hollywood science fiction. But the technology is now finding its way into everything from video games and movie theaters to operating rooms in the inpatient setting. As the cost of hardware and software drops and handset capabilities increase, many companies are developing creative solutions to address problems in healthcare. Products like the Oculus Rift and Microsoft's Hololens have set a high standard, and the industry just got a further push by Apple's recently launched ARKit. Here to tell us about it is Dr. Rafael Grossmann. He's a surgeon specializing in general, trauma, advanced laparoscopic, and robotic procedures. Rafael's been working to advance the use of AR, VR, and mixed reality technology and advises companies in this space. In addition to his full-time role as a practicing surgeon, Rafael is an alumnus of Singularity University and a faculty member of Exponential Medicine. He tells us about some of the great work being done to develop solutions using tools like ARKit and the Hololens platform. You can get all the show notes from this episode and watch some of the talks that Rafael did at TEDx and Exponential Medicine. Just go to digitalhealthtoday.com/49. And while you're there, please take a minute to subscribe to the podcast on your favorite platform and join our community. You can also follow us on Twitter at DHealthToday and follow me at HealthTechDan. I'd love to hear from you, especially if you are an AR or VR company working to develop solutions in healthcare. Please do get in touch. Okay, now let's tune into the conversation with Dr. Rafael Grossmann. Rafael, thanks for joining me. Welcome to the program.
Great to be here. Thank you very much.
Rafael, I've told the listeners a little bit about you. Can you fill in some of the blanks and maybe explain how it is that you came to be in the lovely area of Maine, USA, from your home country of Venezuela?
Well, I'm from Venezuela originally. That's correct. I went to med school in Venezuela. And after med school, a couple of years of rural practice, which is the way we pay our social debt after having gone to med school for free. And then after that, I was in Chicago for a year. Then I ended up in Ann Arbor, Michigan, doing my residency in surgery. That's what I wanted to do. I wanted to train in the U.S., which I thought was the place where probably the best training of surgery that I could get was located. And after 7.5 years in Michigan, I went back to Venezuela. Unfortunately, the situation in Venezuela was one that was starting to decline, and the future was not so clear. So I ended up looking back to the U.S.
And now you're up in Bangor, Maine, which is a part of the world I have to admit I've never been to. What is it that you do, and what does your practice focus on?
I'm a general surgeon, but we do trauma, surgery, acute care, critical care surgery, and also do advanced laparoscopic surgery and robotic surgery. So it's really a wide range of specialties within the specialty, which is a lot of fun and allows me to really develop myself as a surgeon and also as a technologist. A lot of the tools we use obviously require quite a bit of technology. Laparoscopic surgery, robotic surgery. I've been always been very fond of using technology to improve what we do to care for patients.
Rafael, you told me once before about a particular conference you attended that really changed the trajectory of your career and your perspective on how technology can be applied in medicine. And it's known today as the Exponential Medicine Conference that Daniel Kraft runs out in November in San Diego each year. It was known at the time as the Future of Medicine Conference. It's all run by Singularity University. Can you share with the listeners about how that actually changed your perspective and the impact it made?
That conference really indeed changed my professional life, my trajectory as a surgeon and as an innovator. It was at that conference that I, among many things, I heard and saw Babak Parviz, one of the inventors of Google Glass, talk about the technology, about the device, and also demo the device. And when I saw him demonstrating what Google Glass could do live in front of us, I immediately had one of those aha moments. I saw this head-mounted frame, smart glass that you could talk to and you could engage with in order to browse the internet and take pictures and do video and live stream a conference, a call or any situation from the perspective of the user's eye. And I immediately thought this is going to really change the way we communicate and we connect, the way we do medicine and we teach medicine. And indeed, that's what it happened. I tackled him in a way for several minutes, very excited about the product. And a few weeks later, I had gone through the Google Glass Explorers program. I got my device. And a few weeks later, I decided to use it in surgery to stream my perspective of the surgery to a group of students that in a normal situation would be right behind me, trying to see behind my back what I was doing in the operating room live. Instead, they were sitting in the next room, maybe sipping coffee and sitting comfortably and learning from my perspective, connected to me, answering questions, asking questions, and having the best seat in the house to view the surgery.
That was a world first, right? I mean, you were the first one ever in the world to use Google Glass in surgery, right?
Indeed, that was the first time it had been used to live stream a real surgery. I get consent from my patient and the family and the group, and basically did this without thinking much about it, to tell you the truth. And then I have a website or a blog that I do, and I posted something very sort of humbly, and then a good friend of mine, John Nosta of Nosta Labs, who's also a contributor for Forbes, asked me if he could write a little piece on this great news, he thought, and then he did. And within a few hours, it looks like he got a viral spread of this famous post about the first time Google Glass had been used in surgery.
So you were an early adopter, if you will, of the Future of Medicine Conference, which is now known as the Exponential Medicine Conference. You're actually now a faculty member at Exponential Medicine. I know you've spoken there several times. And just for all the listeners, if you haven't seen Rafael speak, I will include the videos of some of his talks at both TEDx and at Exponential Medicine on the show notes of this page. So digitalhealthtoday.com/49, and you'll be able to see the videos of some of his talks there. You were the first to use Google Glass in surgery. Other people may have had the idea. You were the first to implement it. And now you're working on another application of technology, and it has to do with Apple's recent launch of the ARKit and AR Core. Can you tell me what you see as some of the potential for these new tools in relation to medicine?
Yeah, when I learned about ARKit and AR Core, I immediately thought, wow, it's really exponential. It's becoming so easy to have this experience that you, for example, have with the Hololens, which is a $3,500 device. You could have that experience or a very similar type of experience, and in some ways even a better experience with a regular smartphone. And smartphones, cell phones, but especially nowadays, smartphones are ubiquitous. And when you can have that augmented reality, a somewhat holographic 3D live experience on your handheld device, that is going to be revolutionary.
And I know there's a company you've been working with that's developing a solution using ARKit. It's called, I would say the name of the company is Anima Res, ANIMA RES, Anima Res. It's a German company. I'm not sure how they would pronounce it, but listeners can go to animares.com to find out more. Can you tell us a little bit about what they're doing and your involvement with it?
I'm actually one of the medical advisors, completely without any financial interest in my part. And Animares have a platform called Insight Heart, and it's one of many anatomical platforms, if we could call them that way, that in your smartphone, it has to be now obviously an Apple device because it's ARKit, which is a proprietary Apple software, but we render a anatomically correct, high definition, almost real. It's hard to explain, but almost real heart in the space. So this is part of what we call spatial computing. Just to deviate a little bit, spatial computing is a way of doing computing in the space, in a geolocation in a way. So this heart that is in 3D that you can see on your smartphone screen, you can walk around that heart and you can zoom in or zoom out, and that itself is pretty fascinating.
So just to be clear here, so you activate the app, the AnimaRes app, then it actually activates the camera on the phone. You're looking at the screen. It's looking out the opposite side of the camera, so it's rendering the room on the screen. And then on top of that, it's then creating an augmented reality image of a heart. Is that how it actually happens? So then you can walk closer to it and walk further away from it and walk around it by looking at the phone screen while it's sort of levitating on top of the environment that you're in. Is that the way it works?
Absolutely. But not only that, then when I saw what this platform could do, it's a HoloLens, initially a HoloLens platform. So I saw it in HoloLens, and I saw what they were doing by chance right after they went live. And so I was maybe one of their first users, and that's how I became close to them in a way, because I then immediately used it, immediately enjoyed it, immediately thought, wow, this is going to, in a way, really radically change the way we show medical content to anyone. Could be a provider, could be a trainee, could be a relative of a patient, could be a patient, to better understand anatomy and physiology and a procedure or what we are trying to explain to them in a graphic way otherwise. And then I thought we need to connect. So I connected with this company, and then we started working on not just developing this platform even more, but interacting with it. I saw the potential of not just looking at the heart from a spatial perspective, but let's interact with the heart. Let's touch the heart. Let's move the heart. Let's cut the heart. Let's open the heart. Let's connect the heart to your own physiologic parameters. How about we connect the Apple Watch or whatever other tracker you have to that heart, so that the heart, which is, by the way, beating in front of you, beats at the rate that your heart beats. How about if that heart has the flow of your blood when it comes in and out of the heart chambers? How about if we can show different pathologic conditions against the normal conditions, so that when you have a little old lady who has an irregular heartbeat and you're trying to explain that to her, you can then show it on your iPad or your iPhone or her iPhone, her iPad. And then not only that, with the iOS 11, you have this haptic feeling, this tactile almost feeling, where you can hold the phone and see the heart beating, and then that heart is beating and you're feeling the beat in your hand. It's really fascinating.
That is amazing. That the way you just described that gives a whole new level of interaction, right? I mean, we've seen HoloLens before. We've talked about HoloLens in the past, and that is an amazing technology. It's wireless. It's head-mounted. It's entirely contained, and there's some great things about that platform. But what you're describing with this easily accessible Apple platform is something that takes it beyond just observing the augmented reality, but actually engaging with it and feeling it with the haptic feedback, which takes it to a whole nother level. And I'm wondering, what other applications within medicine and within patient education are you guys already thinking about? And can you share a little bit about what that might be?
It's really not just one organ or one system. We want to create, and they are creating. I say we because I advise them, but they are an incredible group of smart people. And we've talked about creating, and we are creating a whole body inside, not just inside heart, but inside body. And certainly the lungs are the first thing that come to mind, because they can be very impactful in the way you see what's happening in your lungs, how they are a dynamic organ in a gross and also in a microscopic way, but how they can be affected by the way you behave. And we talk about health, we talk about improving health. maintaining health, recovering health. I think the lungs, it could be a very easy graphic interface, to really see what's happening to your lungs because you have smoked for 30 years or because you have been exposed to chemicals or whatnot. And certainly there are, as you know, many wearable devices and trackers that indeed record or stream your physiologic data. And if you connect those to, let's say, a pair of lungs that are beating in front of you in augmented reality, that could be really fascinating. The next organ is probably the brain. There are trackers out there that can easily record electroencephalographic activity, electrical brain activity, with a portable device. And many of those devices are out there for sale at the consumer level. You think about Muse, the Muse device that I, by the way, first saw at the first time I attended Future Med and Exponential Medicine. So connecting your own brain activity to a floating brain in front of you can really teach you quite a bit. Imagine the potential to teach people and to display in a graphic way Alzheimer's or Parkinson or contusions, concussions. The potential is only limited by how creative we can be.
We'll dive back into our conversation in just a moment, but first I wanted to tell you about an exciting upcoming event that is dedicated to catalyzing the adoption of digital health technology in clinical orthopedics. It's the only one of its kind, and it's a great one. DocSF is the digital orthopedic conference and is supported in part by the Department of Orthopedic Surgery at the University of California, San Francisco. DocSF will be held just before the JP Morgan Healthcare Conference in the beautiful city of San Francisco on Sunday, January 7th, 2018. This year's focus for the innovation competitions will be artificial intelligence, virtual reality, and augmented reality. The keynote dives into the future of sensors and clothing, and the various talks by world-renowned speakers will cover robotics, automation, and cybersecurity. There are also special sessions on leadership, policy, and design thinking, developed with content partners such as IDEO and BTS. Now you might be asking, why is this conference exclusively around digital orthopedics? Well, implementing digital technologies in an integrated vertical like orthopedics is more likely to affect change than targeting the entire healthcare sector at once. This conference isn't just talking about change, it's focused on moving the ball forward by targeting the key leaders in healthcare who are positioned to make change happen. This conference attracts top professionals from the medical device industry, investors, entrepreneurs, and payers. In short, it brings together all the people who get stuff done in healthcare. #GSD. Head out to San Francisco for this conference and meet many of the guests that have been on this program, including Dr. Daniel Kraft, Nick Adkins, Professor Shafi Ahmed, Dr. Justin Barad, Jamie Edwards, and of course, the founder and chair of DocSF, Professor Stefano Bini. And as a listener of this program, you can enjoy a 30% discount. Visit docsf.org and use discount code DHT30. Tell them you heard about it here. Again, that's docsf.org and use discount code DHT30. Or simply follow the link from the show notes of this podcast. Now let's jump back to the conversation. All right, I just want to bring people up to speed on what we've been talking about. The product we've been discussing is Insight Heart, and it's actually an iPhone app that's available now. You don't even have to just take our word for it here, what we're talking about. You can actually see this if you have an iPhone and you've got the iPhone iOS 11 loaded onto it. You can actually download this app, view it on your phone, get the haptic feedback as well, and see what it is that Rafael's been sharing with us, and actually get your mind working about what actually could be next and what is coming next. The website is insightheart.com. That's insight-heart.com. You can obviously search for it on iTunes as well, or of course, to make it easier, you can just head over to the show notes at digitalhealthtoday.com/49. If you go there, you'll find a link to the app. You'll find a link to the website for the company who makes it. You'll also see some of the videos that Rafael has done at TEDx and Exponential Medicine, so do go there and check it out. Now, Rafael, this whole area of VR and AR is accelerating so quickly now. It seems a lot of people were really skeptical about the application of this technology in healthcare, which is, let's face it, it's fairly typical. But now there are a lot of big problems that are being addressed through these tools, everything from surgical training and education to actual uses in live surgery. For example, we recently saw the headlines by our mutual friend, Professor Shafi Ahmed over at St. Bart's in London. He recently did the first mixed reality surgery. He had people from Mumbai and London teleport into his operating room in St. Bart's in London. and he could actually see them in his HoloLens that he was wearing, and they at their remote ends were wearing virtual reality glasses where they could see what he was seeing. So really an amazing application there, and really takes this whole telementoring that I was involved with, almost 20 years ago to a whole new level. I mean, we were just excited to have flat screens or projection screens, and this is actually beaming people inside headsets and beaming images into headsets. Is really just an amazing application. So what other sort of things are you seeing that have caught your interest in this space?
Well, mixed reality is really now my focus more than anything else, including what we just talked about. But I've been interacting with a company called Medivis, Medivis. Medivis is an incredible group that is creating basically HoloLens content, mixed reality content for healthcare directly, not just at the level of educational renderings of teaching, but at the level of diagnosing, at the level of therapeutics. So almost the three steps of healthcare, educating and prevention, and then diagnosing, and then treating a problem. And the Medivis it has a surgical focus. It's in fact founded by medical people, by surgeons, and I had the chance to connect with them recently, and I've been exploring what they're doing and having access to some of their very interesting content, and it's also fascinating when you can use HoloLens, a little bit similar to what Shafi and the other two physicians did, except that we are going so in the whole spectrum of healthcare. You are, let's say, rendering an anatomical structure, just like what we talked about, ARKit and Animaris and Inside Heart. You're doing that in the HoloLens. And then that same teaching in mixed reality, you can translate to a real patient and to then diagnose, let's say, render the imaging that this particular patient might have obtained in order to diagnose her or his problem. And then you can bring up the radiologic studies in a 3D holographic manner right in front of you, and you can interact with them in a way that we have never done before in medicine.
Wow, Rafael, I'm actually on their website now, Medivis, Medivis.com. And yeah, this looks like a very impressive solution. I'll tell you what, why don't we put an open call out to all the VR and AR developers out there, because there's so much stuff happening. If you guys are working on anything in the VR, AR, mixed reality space, send us a tweet. Tag us at DHealth Today and let us know about it. I will pass it along to Rafael. You can also copy him on the tweet at ZGJR, and anybody else you like, of course. But I'd be very curious to see what other solutions are coming out there. These are two companies that I've just only discovered during this conversation, and would love to hear more, because I know there are a lot more, especially with CES coming right around the corner. I know there's a lot of great applications. So send us a tweet, DHealth Today, and let us know what you're working on. We'll try to share it out to our community as well. Rafael, I know we're coming up to the end of our time together. I have 6 questions I'd like to ask every guest. Do you have a few more minutes for me?
Absolutely. Anytime you need.
Great. Rafael, can you tell me a saying, quote, or phrase that motivates you?
The smart use of technology to improve healthcare and medical education. It's all about that.
What advice do you have for others working to innovate in healthcare?
Be curious and be disruptive. That's better advice that I have. I once someone told me, my brother told me, that he met Nicolás Negroponte, the founder of the MIT Media Lab, and he was in Venezuela for a couple of days. And Nicolás Negroponte, after a couple of days in Venezuela, said that Venezuelans have a healthy disrespect for authority. And I really believe that. I paraphrase Dr. Eric Topol when he talks about the creative destruction of medicine. You need to be disruptive in a creative way in order to innovate.
What book do you recommend to our listeners?
Well, I'm a practicing physician, and I'm a fan of reading Dr. Atul Gawande. And Atul Gawande has written many pieces. His first book is called Complications, and it's more about medicine than it is about technology. It's really all about medicine for the common person and for the advanced medical person. I think that if you're human, you need to read that book because no matter if you're a physician, a provider, or a patient, Complications is the book to read. But also, I quoting again Dr. Topol's book, The Creative Destruction of Medicine, and then The Patient Will See You Now. Those are two books that really, in a way, inspired me to try to be what I'm trying to be.
What's a piece of tech that you use that you wouldn't want to live without?
Well, I think the smartphone is probably the most useful tool that we use, that I use these days.
Sorry, Rafael, the jury says I cannot accept that answer. I need you to be more specific. And on the smartphone, what are some of the apps, what are some of the tools that you use on it that make it so valuable?
For healthcare-related matters, for innovation-related matters, I think that social media is a must. I'm pretty active in LinkedIn and in Twitter. I have a few thousand followers, I guess, in Twitter, and that's a good way to communicate. And in regards to what I do as a futurist, I think that those two communicating tools are probably the most important ones.
If I gave you a check for $5 million today for you to invest in health technology, how would you invest it?
Wow, I'll thank you, Dan, and then I'll think about probably deep learning systems and blockchain. That's the future of healthcare. Artificial, or let's say augmented intelligence. AI and blockchain, I think, is probably the right formula in order to really bring healthcare out of the mess that we're in. So I'll probably invest most of it in those two factors, combining them to make a better healthcare and better educational tools for people. And I'll probably donate a whole bunch of that money to a good charity.
Well, let's talk about donations. The last question I have for you is that we make a contribution to a charity in appreciation of your time on this show. What charity have you selected, and can you tell me a little bit about what they do?
I'm really a believer of global access and access to healthcare. I think that one of the most organized systems out there to do that, it's Médecins Sans Frontières, Doctors Without Borders. And it's probably a very well-known one, but really not that well-known. People don't really know what these providers really do and what they do in the most infernal parts of the world where there is need for caring people and for caring providers. And I think that that's probably money that if you invest it, if you donate to them, is certainly not going to go to waste, and you don't have to worry that money is going to be used for a good cause.
Excellent. That's a great organization. Thank you for nominating them. That's Médecins Sans Frontières. I'm not sure how my pronunciation is doing, but the website is msf.org. We will make a donation to them in your name and encourage any other listeners who are led to do so to make donations as well. Rafael, what's a good way for people to follow you and keep track of your work?
Well, the best thing, I do have a blog that it's almost a website really now that I try to keep active as an educational site. Is rafaelgrossmann.com. Rafael as my name and Grossmann as my name as one word, rafaelgrossmann.com with two S's and two N's. You can learn about what I have done and I do and I'm planning to do. I have an interactive map, a Google map of events where I have spoken and where I will be speaking, and also a lot of educational tools for students and for the public in general. And also I'm very active, like I said, in LinkedIn and in Twitter. My Twitter handle is ZGJR, Z as in Zorro, GJR. And I'm always there somewhat sharing what I think it's worth spreading, using the TED motto, but also especially learning from people all over the world about how to innovate and use technology to make healthcare and medical education better.
Excellent. Well, we will include links to both your website and your Twitter handle on the show notes for this episode, so thanks very much for sharing that. And before I let you go, is there anything else you want to say to our listeners?
Dan, I want to thank you and thank you for the opportunity to be in your amazing podcast.
There you have it. That's Dr. Rafael Grossmann, healthcare futurist, technology innovator, surgeon, and educator. Be sure to visit digitalhealthttoday.com/49 and connect with Rafael on LinkedIn and Twitter. You can see all the links to all the resources and companies we discussed on the show notes. You'll definitely want to check out his talks at Exponential Medicine and TEDx that we have on the show notes as well. While you're on the website, please take a minute to subscribe to the podcast. It only takes a few seconds, and if you leave a review on iTunes, I'd really appreciate it. It really helps to let others know what you're getting out of the podcast and helps to grow the digital health community. Many thanks to our partner DocSF. It's a great conference organized by Professor Stefano Bini at UCSF, and it's coming up on January 7th. It's not too late to register. Visit docsf.org, and you can get 30% off with the discount code DHT30. There's a great lineup of speakers, including Nick Adkins, Shafi Ahmed, who we just spoke about on this program, Jamie Edwards, Daniel Kraft, Matthew Holt, and those are just some of the speakers who have appeared on this program. I plan to be there as well, so reserve your seat, and I look forward to seeing you there. Follow me on Twitter at HealthTechDan and follow the show at DHealth Today. As always, thanks for listening, and until next time, keep on innovating.